And medicine has changed so much since 1967 to now, and is changing so rapidly as we move forward, going from now changes occur probably every year to two as opposed to every 5 years. People need to think about medicine very differently. Doctors need to be enterprise leaders. It's not just doctor-patient relationship. They have to know how to work within the system. They have to know how to work with the insurance carriers. They have to know how to work within the new Affordable Care Act, which, as we all know, will change many times in the future, just as Medicare has evolved since its inception, so will the Affordable Care Act. So physicians need to be taught leadership. They need to have a skill set which teaches them to lead in this new marketplace. Otherwise, they're not going to be successful.
Well, what Barry says is important because many times there's confusion between leadership and management. And management is really, really important. And it's still very different than leadership. If you're managing a system and keeping it going, well, that does require great management skills. If you're talking about being able to create transformation, anticipate where the system is going, and provide leadership to a large group of people, then that's a different set of skills. And I think, as Barry said, for physicians, for nurses, for healthcare administrators and managers, for those in the allied health professions, this is a new layer of capability, a new layer of understanding that's absolutely critical for all that's going on in healthcare today. Anyone who's a leader in healthcare today has to ask themselves the question, how does the Affordable Care Act and its implementation require me to lead differently? And it's thinking in terms of the enterprise, thinking in terms of that meta view, and then being able to rally people so that people follow you, that really are the themes of this course. And because we've had a lot of experience teaching people in healthcare, teaching people in emergency preparedness and response, the curriculum has been honed over the years to give people the skills and capabilities to do just that.
And the Affordable Care Act is the most obvious change, the one that gets the headlines the most often. But the more long-standing trends that are changing healthcare are things like an aging population, a more diverse workforce, technology that is experiencing exponential change. So it becomes a very different set of tools, a different population that you're working with, that you're leading, and you have to begin to understand where that's going and how that means you need to adapt the old models, sometimes throw them away and adopt a new model, or sometimes transform what you've had. It's a very different world in which you're practicing. It's different medicine which you're practicing, and it's in some cases even different conditions you're treating.